like an intro, huh? Be like, "Hi, I'm so and so, and we're here."
Yeah.
And I'll be, yeah, woo.
Police flag. So you gotta show up. How often does a code brown happen? Do you have an estimate on it? Like, is it a once a day thing? Once a week thing?
Let me collect data, and I'll get back to you in about a month or two.
Welcome to another presentation from the CV Academics Foundation, home of the AMP Honors Program.
Hello, AMP Honors Program. I'm Riley. I'm here with Kyle Fenlon. He is a certified surgical technician for Bellin Health, Titletown Sports Medicine and Orthopedics. He also takes occasional call for surgical or as a surgical assistant for Senergy. So, can you tell me a little bit more about surgical tech? Kind of the ins and outs. Like, what does a day in the life of a surgical tech look like?
So my day starts off. I come into work. I punch in at work, and it's go time. I walk in, I get on my scrubs, I put on my scrubs, get out of my street clothes, get in my scrubs. I'll see the circulating nurse. She's getting ready along with the tech, preparing and getting stuff in our room ready and set up. And by that time, I go in and I make sure we have all the positioning devices available. The bed is ready for the patient to come in. And then right around that time, the circulating nurse will arrive with the patient. And we'll get the patient ready for a spinal. We administer spinals for our total joint replacement for our knees and our hips. And then once the spinal is administered, we prepare the patient for positioning. We position the patient. All the fun positioning equipment I come on over with, and I start getting that ready. And lots of times the rest of the team is starting to trickle in and get ready too with me. The docs will show up. And their assistants will come on in, and we start collaborating and talking about that case and the upcoming cases, and we're getting ready. And then once positioning is good to go, we drape for prep, and we usually exit about that time to actually get our scrub on, so we can come in and don all of our surgical attire. And then we get our surgical attire on, and it's game time. It's so much fun. Yeah, we go right at it. We start draping. We'll drape out, and then we assist. Let's say in this case we're doing a knee. We'll assist throughout the case for the knee. I'll help out. Each surgeon is a little bit different in where I'm helping and doing because of Liz or John. Their first assistances, and then at the end of the case we'll do our closing, and whether I'm with John or Liz, whatever, we'll close up the wound, and I'll jump next to the next room while they're bandaging up the surgical wound and preparing the patient to move them from the operating table to their bedroom bed. And I'll be in the next room, rinse and repeat.
So when you say doing a knee or doing a hip, are they total hip or total knee replacements typically, or what are kind of the different surgeries?
Total.
Yeah.
Those are all totals. Yep. That's the bread and butter we work with. Okay. We do also revisions. Lots of knee revisions. They all been very successful and everything like that. Some of them you have to do a little more construction than the others, but it's a lot of fun, a lot of thought in there, and those boys, they put their all into it. It's amazing. Yeah.
So is kind of surgical tech, the job responsibilities, how similar are they between settings, I guess? So once you are certified as a surgical tech, can you kind of go to any specialty, or do you get certified in a certain specialty of?
Well, okay, so when you become certified, like nationally certified, first off is you become a CST, which means you basically can go anywhere in the nation.
Gotcha.
You hands down, you're good. There are, if you lose that credentialing, some hospitals won't even accept you.
Okay.
So my advice is, you're gonna have to pay a couple $100 every so many years to keep your continuing educational credits going, but you maintain that certification. To answer your question, when you go into the specialty things, some hospitals, when you go through your orientation and things like that, they'll ask you, or where you perform and you shine the best, they'll try to keep you in that area.
Right. Okay.
Like yeah, you really grasp ortho. You understand, the ins and outs and the mechanics of the instrumentation to be used, and what the reps are bringing in. You know how to use the reps instrumentation really well, and so that would be your good to go to. So they try to keep you in those specialties, or if you're just all around really good, then hey, what do you like?
Yeah.
But like I said, some hospitals they don't have specific specialty areas. But I lucked out. I love ortho, and I made it known. I said, this is what I like, and this is where I want to be. These are my aspirations, and I shared them. People aren't mind readers. Share your aspirations, what you want to do, where you want to be. I guess, I just looked at it like, hey, I'm 40. I don't have much road left ahead of me, and I want to get to where I want to be.
Can you talk to me a little bit more about how much schooling is necessary for the certified surgical tech? Is it just the 2 years?
2 years.
Or is it a bachelor's and 2 years? It's
2
just
years.
2 years. Okay.
2 years, yeah.
Awesome.
You don't need a BA or BS or anything like that. It's 2 years. So you can go right from high school and go right in.
Wow.
Now, if you're a senior, hey, more power to you. Start picking up some general classes. Pick up your general classes for the TC, and those are going to be your basics, like your English and your math and all that stuff. Get those out of the way, because then once you graduate from high school, you jump right into the fun stuff.
Right.
Right into all the fun learning of what you're actually going after.
Yeah.
Yep.
It sounds
you're ahead of the game.
It sounds like a really good way to get into the medical field. Like, it's a quick way to get right into the thick of things.
Yep.
Can you take me through what is your favorite and your least favorite thing about being a certified surgeon?
Yeah? Okay.
Do you have one? Do you know?
I'll start off with the least favorite.
Okay.
As to why, there's so many things I like.
That's fair.
Least, we call Code Brown.
Okay.
And Code Brown, I think I'm not going to get into details here, but it's pretty self-explanatory.
I think I know where you're going.
Those aren't the funnest. They can get kind of pungious, pungent, messy. And if it were me, I would like to be cleaned up too. So
for sure.
You got to do it, man. You have to do it. It's part of your job.
Yeah.
But I'd say that's the least part.
So, and before you get into your favorite, if you have a particular favorite, how often does a Code Brown happen? Do you an estimate on it? Like, is it a once a day thing? Once a week thing?
Let me collect data and I'll get back to you in about a month or two. No, it's not a weekly thing. It's not a daily thing. It just happens.
Right.
It just happens.
Yeah. So, do you have a favorite? Do you have a particular favorite thing?
I think this is the best answer I can give you and the people here.
Yeah.
I've been doing this for 4 years. I've never called in sick.
Wow.
I think that says it all right there. I love it all. I go there. I'm happy to see everybody going down the hallway, high-fiving, saying good morning, fist bumping. I just love it all. Working with the people I work with, my teams, they're just all around good-hearted people, knowledgeable, professional. We know what each other expects, and they're dependable, reliable. And I mean, there's not just one thing.
Mm-hmm.
The one thing is I'm doing what I want to do. That's the one thing.
Yeah.
And it's with the people I want to be with.
So I guess, could you tell me something that maybe you know now that you would tell your younger self, like some advice you might give to your younger self?
Yeah, I would tell myself, believe in yourself. Be persistent.
Mm-hmm.
What the mind believes, you will achieve.
I like that.
Yep, because it's the honest to God truth.
Yeah. So how do you relax during time off? Can you take me through kind of a day in the life of Kyle Fenlon? On like a day, an off day. What's your go-to?
Yeah, not too much exciting here, but I love the outdoors. So I'm outside. In the summer, you're going to find me outside, whether it's from cutting my lawn. I have a pattern. I have a regimen I go through. It's cutting my lawn, washing my Jeep, cleaning the Jeep out, taking the doors off, getting ready for the weekend, and actually traveling up Door County
Mhm.
with the Jeep, going off-roading with the Jeep, cookouts by the water up at Horseshoe Bay,
Okay.
and a lot of yard work. I like my yard work.
Yeah, there you
Yeah,
go.
I take pride in it. It's a nice stress reliever for me, and
Yeah.
my gym time.
Okay.
I enjoy that. I've been deprived of that for the past quite a few months here, but that's soon to come.
Mm.
So we'll get back into that eventually.
Yeah. Do you have any role models, maybe in your career path now as a surgical tech?
You know, I'm gonna be really honest. I don't have any role models, but I look up to a community of people, and that's my team, Dr. Kleiss, Dr. Conrad, you know, Liz and John. Those are the people I look up to, and they mentor me, and I couldn't be the happy. You know, I couldn't do any better than that.
Mm-hmm.
To be mentored on the job, to be taught. You know, I've been with him, with Dr. Conrad for about 2 years now, and I'm constantly learning.
Yeah.
Constantly learning. I think that it will be a learning for the rest of my life.
I think that's something that's pretty common in the medical field in general. Just people that are kind of almost thirsty for more, thirsty for more knowledge, I guess.
Yeah, it's. I mean, I know one individual. He has 4 degrees.
Wow.
You know, one of the surgeons I work with, he was an engineer, and then he became a doctor, a surgeon, orthopedic. You know, I mean, nonstop. I mean, that's the kind of clientele and people you're going to be, you know, around. You know, and you surround yourself with that, and that's the beauty of it. There's so much knowledge and so much to be learned from one another, and it's just, it doesn't matter who you are. It doesn't. Whether you're, you know, a circulating nurse, a tech, a surgeon, CRNA, you know, anesthesia doctor. Everybody learns from everybody. It's an amazing career path. I love it. Yep, very happy with it.
So let's get into the career path a little bit now. So you mentioned you didn't really have a role model necessarily, but how did you get introduced to like surgery, being a surgical tech? Like, what was your start?
We got an hour or so here. So my start was, well, you know, the background. I don't know if the audience does, but I'll just give a synopsis.
Yeah.
Graduated from University of Dubuque with a sociology criminal justice degree. I pursued corrections, and I was a correctional officer at max security for 13 years.
Mm-hmm.
After I decided it was time for me to move on. And at the time, UW Wisconsin Hospital was hiring security, and that was my in. That was my in to the healthcare area.
Just a security job.
My goal was to surround myself with healthcare workers.
Yeah.
And what a better place to do that than at a hospital.
There you go.
So anybody that was willing to talk to me about what they did and what their role was, I listened to, and then I weighed out, is this something I'm going to be interested in? Is this something I'm going to like? Is this a path I would enjoy doing?
Yeah.
Now, the day that I realized surgery, the environment of surgery, that's where I wanted to be.
Yeah.
And that day was when I was bringing a procurement team down to the morgue who was going to do some harvesting. And I picked the surgeon's brain, I picked his teammate's brain, the traveling tech that was with them at all the time, I picked his brain. And I realized, you know, I want to go back to school. I think healthcare is where I want to go, and I want to direct myself towards surgery. So I found it very intriguing, and the human anatomy and the works of all of it. And next thing I decided was I don't want to go back to another 4-year. I don't want to go for 6 years.
Yeah.
So then I started looking into tech positions, and I found those appealing, and off to the races I went. I put myself in at MATC, and I put myself in here in Green Bay at NWTC, and I said, whatever fish bites first, that's where I'm staying.
Yeah.
And that's how I knew I was meant to come home, back to Door County, back to the Green Bay area, is because NWTC hit me up, and I knew Madison was no more in my life, and now I'm gonna start giving back to my community, and that's what I'm doing now, and I love it.
Awesome. It's such a unique career path too. I think that would be.
Yeah, it's bold and risky. Bold and risky. You know, a guy that doesn't know, who avoided all science classes in high school, who
Right.
avoided all, you know, anatomy classes in high school, anything related in that aspect. And I think a lot of that had to do with the fact of I allowed dyslexia to take control of my life and dictate what was right or what I could do.
Yeah.
It put a border on me, a boundary, and you know, I figured it out late in college, like I said, how to break through that wall.
Mm-hmm.
I wish I knew how to break through it sooner.
Yeah.
Yep.
Yeah.
Absolutely.
So I mean, really awesome that you were able to get here after such kind of like a long backstory. I mean, a lot of students on the site and stuff, they're in high school and undergrad, and they kind of know that medical field is for them, or they're looking into that now, and that didn't come for you until
later in my life.
Yeah, right. And,
yeah.
But here you are, and I think that's a cool kind of twist on it that they might not know much about. So
yeah, well, and I mean, you asked earlier, you know, what's something that a lot of people don't know. A lot of people don't know that my background was actually criminal justice sociology.
Yeah.
There's another one. There's a lot of people, and they're just like, "What? You did what before this?" You know, and yeah, I'm quite proud.
Yeah.
Very proud.
That's awesome. Awesome. So Kyle, could you tell me something that we didn't get to in this interview and that people might not know about you?
Yeah. Not everybody knows that I'm dyslexic. I was diagnosed with dyslexia at a young age. I kept it secret going through middle school and high school, even in college. It held me back a lot. It was embarrassing to me, but as I grew and developed and understood the ins and outs of dyslexia, I tried to turn it into a strength, allowing me, and those strengths are actually really focusing on what I'm doing, focusing on my writing, my numbers. I get my hiccups, everybody does, but it's taught me how to really focus on what I'm doing.
Yeah.
And that's how I turned it into not a weakness and not an embarrassment anymore.
Right.
It's a strength, and it's a hurdle I shouldn't say conquered, but I've gone over numerous times in my life, and I'm okay with it, and I'm open with it. My team knows I have it, and it actually becomes a comedy in my life. Right. It actually brings laughter and fulfillment in my life. It's like, wow, did I just do that? Did I say that in the wrong content, or did I just write that down wrong? You know, and it shows up every now and then, but not everybody knows it.
Yeah, I think that's kind of, I mean, the way you approached it is so cool, and I'm glad you brought it up. Just because it's not necessarily something that was under your control. At least, well, you have it under control now, but it wasn't something that you could control early on.
Right. Yeah.
And just through time, you learned how to kind of manage it and get with it, and then being open about it with your team, that kind of thing.
Yeah.
Like from what you can tell, from what you told me, it's just they handle it and you handle it like it's a non-issue.
And it's not. It's not. You know, I mean, not everybody is perfection.
Right.
We're not. We all have our own little quirks, our own little, knickknacks about us, and that's one of mine, is that. And for me, every day is an adventure. Every day is an adventure. Even though hips and knees, that's not the case. The case is it's an adventure. I'm going in, you're giving quality of life to someone, and you don't even know this person. That's the magical thing about it.
Yeah.
You know, I don't do the clinical base. All my hours are generated in the operating room, and I say hi, I greet, but it's for a brief minute. You know, that's 5 minutes, and the spinal's in, and they're on their way. You know, and then 5 minutes, 10 minutes, we're doing our first incision, and that individual will leave. You know, and they probably won't remember much of anything at all after the case, but memorable for me, and the things I like is that you're actually giving quality of life, you're bringing happiness and mobility and you know, you change someone's life, and you change it in a good way.
Yeah, for sure.
And you don't know them. That's rewarding.
Mm-hmm.
That's the best part. And on top of it, I get to work with the people I love the most.
Yeah.
You know, I shouldn't say the most because I love my family the most, but they are very dear to my heart.
Yeah.
Yeah. And then to be able to do that with people you want to be around, and have that camaraderie and everything like that. Healthcare is the place to be. You know,
Yeah.
You're making the right choice. Trust me. Yeah.
Yeah. That's awesome. Well, thanks for
Thank you.
coming and talking with me, and you're driving all the way down, so
That's all right.
appreciate it.
I'll build Patricia.
Well, it was great talking to you. And Amp Honors program, that was Kyle Fenlon. He's a certified surgical technician.
Get after it. Yeah.
All right, I do have something for you. It's a little challenge. Yeah, that's a good call.
You're stealing my ideas.
All right, so I don't know if you guys have seen, but with quarantine, there was this family I saw on TikTok that they did like a quarantine Olympics, and this was one of them. I thought it'd be kind of fun to try with Kyle. So the premise is we'll start at the same time. We'll start with our hands on our table, and we'll start. We gotta get the gloves on and the mask on, and whoever gets them both on first is crowned the winner.
Oh.
So, and I mean the gloves, you gotta have all fingers.
All fingers in?
Yeah,
Okay.
yeah.
Mask?
Mask gotta be
Chin
on
covered
both
and
ears.
bridged?
Yeah,
And,
it's gotta look good. It's gotta look good.
Okay,
We gotta
okay.
be ready to go into surgery then.
Alright.
Okay, and I'll let you count us down.
Okay. And 3 is going to be the time to go?
It's up to you.
Okay. Alright, you ready?
Is 3 the time to go?
Yeah, we'll go
Okay.
at 3. Alright.
Alright.
1, 2, 3. Oh, just put the mask right away.
Oh no, my pinky got stuck.
Well, I'm going to be an Olympian. Oh, I'm an Olympian.
Wow. I said that just for pride. I just can't. My
I
fingers.
think your meat hooks are too big.
There you go.
You didn't get the right gloves.
No. Well, it was a pleasure.
Thank you.
Pleasure. Thanks for coming down and meeting
No,
with
thank
me.
you. I appreciate
Talking
it.
with me and
A lot of fun.
sharing your story with the Amp Honors program. So
Absolutely.
hopefully, maybe we'll see you on the site sometime again soon.
Yeah, I like that.
Awesome. Thanks for watching, guys. Perfect.
Where's my medal?
This has been a presentation of the CV Academics Foundation, home of the AMP Honors Program.